Hello, I'm Solomé Tibebu, the host of the Going Digital Behavioral Health Tech Conference. I'm so pleased to have John Hansbrough here from LBL Group. Welcome, John.
Hi, Solomé. How are you doing? It's really nice to be here. I'm really excited about this. It's been a really awesome month of a lot of things going on with mental health. And I'm looking forward to this conversation and chatting a little bit more about behavioral health and how it affects employers and our field.
Yes, me too. So without further ado, why don't you start off by sharing a little bit about yourself and LBL Group?
Sure. So again, my name is John Hansborough. I'm an employee benefits consultant with the LBL Group. So employee benefits consulting really is what that means is that we're working with employers and helping them better manage the healthcare of their employees. So that covers everything from analyzing and understanding the insurance programs that they're offering employees, changes they might want to make there, overall managing their healthcare spending. And healthcare spending right now is a huge issue in the country for employers. And there's like not really one good cause for why it's so bad. But you may have seen like a couple months ago that Warren Buffett came out and called healthcare a tapeworm in the American economy. And so when someone like that comes out and says something like that, pretty damning about a $4 trillion industry within this country, like by itself, I think the figure is that the US healthcare system would be the 15th largest economy in the world just by itself. And so there's not one silver bullet for that. There's a lot of different things that we're helping employers do to better manage that spending, improving benefits, improving outcomes for employees, freeing up their cash flow for other pieces of their business that they want to invest in. And behavioral and mental health is a huge piece of that. And so it's a thing that we talk about and we emphasize because not only does it feel like it's the right thing to do for employees, but there's actually a really good business case behind why it's so important to invest in it.
Yes, definitely top of mind for many employers. And certainly I want to ask you a lot more about that. But before I do, can you talk a little bit about what got you into this space?
Sure. So I was an econ major in school, math minor. I was the numbers guy. I got into kind of the more personal side of insurance and financial planning. But the background for me, my dad was a surgeon, my mom was a nurse. I grew up just running around the halls of a hospital. I was the weird kid who grew up with like slides from burn presentations, around the house and stuff like that. So I was always kind of around healthcare. And even now, my mom's now a nursing professor. And so I've always been around these healthcare conversations. So, instead of talking about reality TV shows, we're talking about like scope of practice laws for nurse practitioners state by state and that kind of stuff. So healthcare was always kind of in our blood, in our DNA. And recognizing that there is a really huge, important business case for addressing healthcare spending in the country. It's a really fragmented thing, right? Where we have an employer sponsored healthcare system where each employer is having to start things up from scratch. They're having to enroll in plans with whatever carriers are available to them. They're having to communicate those plans to employees, and then they're having to manage them over time. And a lot of times it's a very overworked person or small team of people at organizations who are responsible for what can be like $1 million, multi-million dollar spend per year. That's a lot of responsibility for something that's so important to people. And so our role is awesome. We get to work with small, medium, and some large sized employers in our region and across the country to help them provide these great benefits to their employees and then find savings and help them with service to make sure that their employees are getting the most out of their benefits. So, when someone is having a kid and they need some help and resources to understand how their health plan is going to affect things, maybe they're undergoing some kind of chronic medical condition and they need treatment, and they need to understand how to best, get the right outcome out of that, spend the least amount of money to do it. And then, case in point, topic today, behavioral and mental health. That field is probably one of the worst, frankly, in aspect for how our benefits plans treat it. We've had such huge advances in cancer, so many other chronic diseases over the last 50 years. We really haven't had much innovation in the mental health field besides the development of SSRIs in the 90s. And so this current movement where we're moving more digital, we're moving more virtual, and we're trying to bring a more holistic set of strategies to the table to improve mental and behavioral health versus beyond just saying go meet with a therapist. That's a really exciting thing. And it makes a really big difference for employees and employers. And that kind of feels like I've got this really interesting connection in a couple different ways to pulling all those pieces together for employers.
Yeah, tell me more about that. So, in terms of What are some of the changes that employers have made to their mental health benefits in the last year with COVID? What are you seeing that's evolving there?
Yeah. So it's a really cool time for this field because it's so top of mind. It's so at the front of conversation nowadays with C-suite executives all the way down to entry level employees. It's being talked about so much more. And that's a really cool thing. My personal background is that my dad, as I mentioned, was a surgeon. He's a really high risk population for depression, suicide, and mental illness. He had chronic depression for 25 years in his career before he ultimately passed away due to suicide back in the early 2000s. And going through that, there was so much stigma around what happened to him. People around the hospital didn't want to talk about it. It was a very challenging time, but there were some really big proponents who pushed for that to be a change and to lead change at that organization, to take better care of the doctors and physicians and other practitioners and professionals who were at the hospital. And after that, their rate of suicide actually dropped precipitously because they took really targeted action on the mental health of their employees. And so bringing that forward to today, where we're at with COVID, is that everyone's forced to work from home. There's a lot of disruption. For some people, they're lonely because they're home alone. For other people, they're in a multi-generational household. There's a lot of responsibilities on the table, and they're not able to give work or school the focus that it really deserves for them to get the best outcome for themselves. And so for employers, we are seeing that it is important and that they're talking about it and they're interested in it. That that interest, that intention hasn't always really been matched up well to outcomes and what it gets put in practice. So there's been some research put out there from PricewaterhouseCooper and Ginger on that disconnect. And so we've talked about this ourselves. There's this disconnect between how leaders think they're doing and how they're communicating about behavioral and mental health, and what employees are actually hearing and what they're seeing in day-to-day practices. So for example, C-suite executives, overwhelmingly, it's like 94, 96%, think that they're doing a great job of emphasizing mental health and the need to take care of it for each employee. Employees, on the other hand, it's like 50 to 60% agree with that kind of statement. And so that's a majority. That's pretty good. But is what we see when we, from our position, looking at healthcare claims, looking at healthcare data and spending, it's kind of a classic 80-20 thing where 20% of your employees are going to represent 80% of your claims and your spending. And so when it comes to mental and behavioral health, that's also going to generally hold. We're going to see about 20% of employees representing the overwhelming incidence of mental health and behavioral health claims and needs. And there's a big difference there because needs in mental health are not always met with claims. If someone has a broken bone or they need to go to the ER, they go to the ER and they get something said. You don't usually see someone walking around with a broken arm for weeks on end without it being treated. Mental health is different. There's a spectrum of mental health conditions that people can have, and it really depends on what symptoms they're showing that can determine whether or not and when they're going to get the care that they need. And so you can have some people really struggling for a while. And so when there are workforces and workplaces that talk about it, but they aren't being about it, that can make it really hard for employees to actually feel like they can stand up, speak up, ask for time off. It's a very big issue for organizations. And so we do see that organizations, there's a lot of risk of increased paid time off, or not necessarily paid time off, but absence and presenteeism are both major issues for organizations when there's undertreated or untreated, like milder mental health symptoms. So to kind of pull apart what both of those mean, absenteeism is just what it sounds like when you're absent from the job. So an employee who is struggling with maybe some milder or intermediate mental health symptoms, they're going to miss some time off work. That's bad for them. It's hard for the organization. It's not great. Presenteeism is when they're at work, but they're not as productive as they could be. That's going to be a struggle for them. They're not going to be fulfilled from work. They're also not going to be doing the job that the employer hired them for. So the employer is going to be frustrated and they might not see what's going on there. I think we've all been there when you get, you're seeing someone not performing and you maybe jump to conclusions about why that is the case. People might be assumed that they're lazy. They might be assumed that they're not hard workers. It might be that they've got some untreated mild to medium to intermediate mental health condition. So we are really seeing this need for executives to recognize that, hey, we've got a blind spot when it comes to mental and behavioral health for our employees. The two main things there that we see is that there's this huge value to creating a culture of understanding and of receptiveness to employees talking about their needs and accepting those needs. And the way they do that, it's kind of like anything else with leadership. It comes down to leaders going first. So 90 again, it's like 94% of CEOs admitted, or they recognized that they had received themselves some kind of mental health treatment in the last year. 94% of CEOs. Okay. How many of them openly talked about their own access to mental health needs and what that was like for them? It's not very common. They have this idea that they need to have this protective armor on, they need to be this like caricature in the office, that they can't talk about their own needs, and they don't want to express that humility. But that's actually really well received by employees. And so when employees see leaders go first, it makes a very big difference on their understanding of what the workplace's take is on mental health and how important and valuable it is to the workplace when they do see leaders go first. So leaders need to address stigma, creating a culture of openness and understanding, and then being willing to go first and share their own experiences.
Thank you so much, John, for first off sharing that about your family. And I know that you do a lot of advocacy outside of work, but to your point about sharing data and empowering leaders to know what's going on with their employees, and surely healthcare professionals and how much they've struggled throughout the pandemic. I really hope that's a message that the audience can take from everything today. Really interesting about the disconnect between leaders at companies versus actually how employees are perceiving mental health supports.
Mm-hmm.
Clearly, we've got a lot more education that could be taking place amongst leaders, but I wonder, in terms of hesitation for employers to adopt even more mental health services, or maybe they're just getting started, many of them are wondering about ROI. Can you talk a bit about expectations for return on investments and what you're hearing from employers?
Totally. So I guess the first thing to kind of address there is that there's an ROI to a lot of benefit spending that you have, right? The way that employers are spending money on benefits, it's perceived as a tool to recruit and retain the workforce they need to push the organization forward, right? And so for a lot of the companies that we work with, like they've got machines, they've got real estate, they've got offices. Their people are their most important asset. And so the companies that are doing probably the leading job when it comes to supporting the mental health of their employees really take that to heart. And so we see that in the conversation. There's some employers where to them, benefits are a necessary evil that they have to offer to be in business. They're not going to be the ones who are trying to be out front, leading the charge, taking arrows in the chest, trying to figure out how to help employees. It's the organizations that do feel like our people are our most important asset. And so for them, they generally will recognize that it's important at the end of the day to offer these kinds of things. But then if we start looking at their healthcare spending as its own supply chain, as we really think most organizations should, that is a thing that a lot of companies don't think about, is they have this procurement process for almonds, they've got this procurement process for iron or steel or microchips or whatever it is. They don't do that for healthcare. So a lot of companies, they'll spend, two, three. I've got one employer who spends $5 or $6 million a year, and we don't really see a lot of what's going on with their spending. And so we're always pushing groups to say, hey, maybe we can make a change, get some of that data, get some of that insight. Once we get that insight, it allows us to see what's going on with their spending, what's going on with their claims. And then we can start taking some really interesting action when it comes to mental and behavioral health, along with other conditions like musculoskeletal, back, whatever it might be, right? Prescription drugs. With mental and behavioral health, there's a really big ROI from these things. We see a much higher incidence of ER utilization for employees who have a behavioral or mental health condition than the general population. Additionally, there's about a 2 times greater spend per month per employee for the employees who have a behavioral or mental health condition versus those who do not. And so when that kind of high spending is seen, and we know that poor treatment is out there, and we know untreated, mild and intermediate behavioral health conditions are out there, there's a huge opportunity to investing in the value of those benefits, investing in employees getting the help that they need. And that reduces, spending obviously in the short term and in the long term, right? There's a lot of correlation between depression, obesity, suicide, diabetes. There's a lot of different conditions that have these comorbidities. And so when we can address depression, we can address stress and burnout, we can get in front of those kinds of things. And then we can also just do some preventative behavioral and mental health care. That's a thing we never talk about, is the preventative aspect of these things. And that has a serious ROI for employers. Again, we're not just talking about their actual healthcare spending when they're writing a check to some provider for services rendered. It also shows up again in that absenteeism. It shows up in the presenteeism that we talked about. All of those come together to provide a really frankly, a very satisfying business case for why employers should be investing in mental and behavioral health.
If that's not convincing to any employer listening, I don't know what is. Can you talk a little bit about what are some of the, specifically around digital behavioral health solutions? Can you talk a little bit about what are the most popular pricing models or different kind of arrangements that are more palatable to employers than not?
Yep, totally. So when it comes to mental and behavioral health, I think we first need to consider kind of where we were maybe 10 or 20 years ago before digital treatment was really an option, right? It used to just be you needed to recognize that you needed to go see some help, or maybe you presented at the ER to your doctor with something that made them think, hey, you know what? I think you need to go see a therapist and talk to somebody. That was kind of the cliche thing, right? I think you need to go talk to somebody. If that's the case, the predominant way that you would access care is for you to schedule time with a therapist. Maybe they're in network for your health insurance, but they're probably not. So you're probably spending out of pocket money to go visit a therapist at some, frankly, kind of inconvenient time that's maybe 9 a.m. to 5 p.m. Right. And so access was a major issue. Inclusion in health plans was a major issue. And so this advent of virtual health, telemedicine, digital health has been really cool because it's recognized the roadblocks that exist to employees getting mental and behavioral health. And so there's different pricing models based on how things work, but I think it's helpful to, again, remember there's in-person visits with a licensed therapist, some kind of psychologist. That is this, like, I think we've kind of used that in some ways for mental and behavioral health as, we've got a hammer and everything is a nail because of that. But for some people who maybe have a mild mental health symptom, it might not be appropriate for them to suddenly go spend $130 per hour to visit with someone, 4 to 5 hours a month. That can be a high spend for a lot of employees. And when, it's like 50% of Americans couldn't meet a $400 surprise expense, I think it's a big ask to suddenly say that we need to spend that much on a therapist, and that can be a hurdle, right? And we see there's plenty of research out there on the cost of healthcare upfront being a burden on people receiving care and avoiding preventative treatment. And so again, it gets back to this idea of what is the preventative behavioral and mental health that we can invest in. And similar to how the ACA requires that health plans cover on a first dollar basis preventative healthcare services, we need to be doing that for mental health healthcare benefits as well. And so that includes things like online coaching, digital therapeutics, community groups. There's so many ways that we can have a lower cost delivery of care on a preventative basis that gets groups started and it gets an individual started with their mental health care treatment. And so from a pricing model, there's different ways that gets done. There's some resources that employees are given access to simply on a PEPY basis. That stands for per employee per year basis. If you're an employer, by the way, and you're not familiar with that concept, this PEPY figure, that's very important for you to start thinking about that number and categorizing a lot of your benefit spending, because it's a good way of understanding your total costs. Because then we'll use that vernacular in a lot of ways to describe, again, like we talked about earlier, the ROI of different benefit programs. And so the PEPY method of assessing costs is really helpful. But sometimes we need to have a variable cost measurement depending on what employees are accessing. And so those can be benefits that, again, are standing outside of your traditional health insurance plan or your health plan. And those digital health benefits for mental and behavioral health, they're going to be paid on a per visit or some kind of variable measurement, depending on employee utilization. And so if we don't see employees utilizing a service, they're not paying for it, the cost isn't going to be there. There might be some kind of cost sharing element involved. It is sometimes helpful to have skin in the game for employees that they're spending out of pocket for services. On mental and behavioral health care, though, it is a pretty valuable first dollar benefit that we should be providing to employees, at least from our sense and what we see for the business case for it. And so we do see a PEPY measure way of paying for it, and we do see a variable cost way of paying for it. It can just depend on the tool, the amount of human labor that goes into delivering a unit of care. Because some of the digital health tools, they scale really well. They might not need to be paid on a variable basis. Other ones that are a little bit more human labor intensive, and we would consider a therapist, who needs to spend that hour with someone and they have degrees of training to do that, or some kind of coach, right? There are different modalities of that care depending on the practitioner's experience and background. There are ways of doing that on a per visit basis that can also be effective.
Super helpful. And on the flip side, we also have many digital health startups in the audience here today who are thinking through these things. And could you give anyone listening who's just entering the employer space some advice around, in today's day and age, how do they sell their mental health solution to employers?
Yep. So when it comes to selling to employers, they hold the purse string, right? We always talk about that. Like if we're trying to change American healthcare, employers are a really good starting point for that because they control so much of the spending that goes on in the healthcare system. When we then subset that down to mental and behavioral health benefits, again, we have to keep in mind what we talked about earlier, that disconnect between leadership and employees on perception of benefits rendered, environment and culture established when it comes to mental and behavioral health. We have to keep that in mind when we're trying to sell to them because they might be thinking that they're doing a good job on something. And if you're in sales, if you're familiar with sales, and a lot of these digital health companies, they understand that you need to kind of frankly disturb companies a little bit to help them understand where they're not getting it done for their employees' mental and behavioral health. The executives, the CEO, the CFO, the chief, human resource officer, they might think that they're doing a good job, but there's that disconnect with the employees. And so it's important to try to figure out if there's a recent pain point for them to understand where their benefits might not be getting things done and how your solution can then fix that for them, right? Because yes, it's a very receptive time for mental and behavioral health. You're probably going to get the ear of someone to at least hear you out. But you got to keep in mind that a lot of times the buyers of these organizations, they're getting emails all the time. They're hearing from people like me who want to just overall handle the plan. They're also hearing from individual vendors like digital health vendors, telemedicine, again, specialty conditions, pharmaceutical drugs. There's so many vendors reaching out to these people. They're just frankly inundated. There was a really good article, I think it was in the Wall Street Journal recently, actually about buyer burnout. So the person at an organization responsible for all these solutions, because there's so much money pouring into the space. And I think if you look at it over the last 10 years, there's been like $4 billion invested in behavioral and mental health startups in the last 3 years. And that's more than the $1 billion in the preceding 7 years. So there's a huge influx of resources that are suddenly now reaching out to these purchasers at organizations. They're getting really burned out. And so to break through that, frankly, from a sales standpoint, you've got to find a pain point. A lot of times the pain point is going to be some employee who had a bad experience. That prompted us to look. Actually, we had a bad experience with one of our employers. They had a bad experience with a key employee whose child wasn't able to get the help they needed and ended up needing to get some services that were not ideal, wasn't what the family wanted, but it was because they weren't able to get the services upfront that they needed kind of in a timely manner, right? And so that prompted us to reach out to the carrier and say, what the heck's going on? It's led us to assessing and saying, hey, you know what? We're going to need to go look at a different vendor to take care of this because they're just not getting it done. And that's a pain point that is very top of mind for that employer that we are relating everything to, because there's a general sense of needing to take care of these things. But like we said, there's also a general sense that we're doing a good job from the employer standpoint. So you need to find that pain point. You need to understand what kind of recent story do they have that brings to mind, it brings to point, it brings to the front of their consciousness what's going on with their current benefits and how you might be able to improve them.
Really great advice, John. So what if now there's a partnership in place between a vendor and employer? How do we make sure there's a successful implementation and they're not going to be just one of those mental health solutions where the leaders think it's working and employees actually don't?
Yeah. So as employee benefits consultants, we're communicating benefits to employees. And like 90% of that, 95% of that communication comes at renewal time when employees are getting in their portal, they're making plan changes, they're confirming that they're just rolling plans over and they're moving on to the next thing in their day. So we get this really limited window of time to communicate benefits to them. It's very common that employees get to open enrollment and they go, oh, I didn't know we had pet insurance. I didn't know that we had life insurance. Like, there's so many things that we put in place for employers and their employees. And we think this is such a good benefit. And if an employee doesn't pick it up at that time, they don't remember what their benefits plans are. They don't remember who they currently have. Like I was on the phone with the CFO the other day. He had no idea who their carrier was because he's just not thinking about it all the time. And so likewise, employees aren't thinking about these things until something happens and they maybe click and say, hey, I think we've got Aflac or I've got, something or other like that. When it comes to mental and behavioral healthcare benefits, specifically, we see a lot of times those provided as an EAP. That's an employee assistance program, and I'm sure you've got some groups on in the conference who are going to be talking about those in greater detail. Basically, that's kind of this open-ended platform to delivering different kinds of specialized benefits, and a lot of times that's how we see mental and behavioral health benefits delivered on top of existing health plan benefits. And so within EAPs, sometimes they're just tacked on with other lines of insurance from insurance carriers. Those kinds of EAPs, they're low cost, but they're kind of not really the Cadillac version of this kind of benefit. And so with those kinds of EAPs, they're not very well communicated to employees. Employees don't have them top of mind. We'll see utilization rates sometimes at 2, 3, 4, 5% across an employee population. And that's not really high. And so when we do have successful implementation with an organization, we've done a good job communicating to employees why they would want this benefit, not just what the benefit is. Again, we've got to put it in their context because an employee doesn't go into open enrollment and say, God, I wonder who our EAP is this year. They don't know what that means. They just are thinking, okay, I need health insurance. My husband or wife wants, a certain doctor. I just need to pick this one. So we need to go to open enrollment and say, if this is happening to you or you're undergoing something like this, you should be aware that we have an EAP to help you with that. And so a mental health EAP in communication and in conjunction with the employee benefits consultant can do a really good job educating employees at open enrollment time with what's going on and how to access their benefits. And then additionally, throughout the year, again, the strongest EAPs that we work with, they are making sure employers are aware of educations and trainings and stuff like that throughout the year and staying in regular communication with them. They kind of want to be that noisy, squeaky, presence who are making employers aware of what they have and what they could take advantage of. One of those EAPs, for example, for one of my clients, they did a training earlier on in COVID about developing resiliency amongst your workforce. It was really well received. And that came about because they were very proactive and they're reaching out to the employer. And we were also communicating and saying, especially at the early time of COVID, where there was so much in the air, we didn't hit a rhythm, frankly, with how lockdown was going. We were communicating to groups and saying, what do you need? What do you need? What do you need? Have you thought about resiliency training or something like that? They were really receptive to it. The EAP delivered it, and it was awesome. That kind of successful implementation and results doesn't come about from sitting back and waiting for employees to ask for benefits. Because if we know anything, and I'm sure just, this entire conference is pulled together, there's still a stigma to thinking about this stuff and recognizing that they need to get the help. Again, if I scrape my arm and it's bleeding and I can't stop the bleeding, I'm going to go talk to somebody. But if I'm not in a good place and I've been struggling, if I'm lonely, if I'm going through some kind of stress, if it's financial, marital, workplace related, people still don't think to go reach out and ask for help from someone. And so successful implementation needs to educate employees on if X, then Y, right? So if something's not, working, just call your EAP, talk to the EAP. If you need immediate treatment or assistance, they'll connect you to a clinician and you can usually see them in the next day or two. That's a really cool benefit from EAPs. They're a really interesting opportunity actually for care navigation, getting employees started with the healthcare system. And so that implementation, it's got to communicate that to employees. Because if employees don't know about it at open enrollment time and they're not communicated about it during the year, they're just not going to use it. And the worst thing we have is when we have benefits in place for employers and they're not used for their employees' benefit.
Really good advice. And in addition to all of that, I liked your point early on about ensuring that leadership share not only what's practically available, but even their own stories to break through some of that stigma and show that this is a culture of wellness and taking care of oneself. So really wonderful advice. John, I have to ask, where do you think the future of employee employer mental health benefits is going?
Yeah. So it's a really good question. So I touched on it a little bit earlier. I think that we're going to start to see, I don't know if we'll see full on legislation around it, but I do think that preventative mental health care benefits are going to be something we see more of. Because right now, typically mental health care is delivered after some kind of significant episode. So if someone presents, suicidal ideation, burnout, depression, or whatnot, at the time that usually they're getting care at this point, it's had minor to major effects upon their life. That's a really bad situation for us to find ourselves in. And that's an issue that we're addressing in, frankly, every other part of healthcare. We're trying to get ahead of cancer diagnoses. We're trying to get ahead of type 2 diabetes by addressing pre-diabetic employees, right? There's so many areas of healthcare where we're emphasizing this preventative treatment, where a dollar of prevention can prevent $4 of spending. We're trying to see how we can do that as well in mental and behavioral healthcare. I think there's a lot of opportunities with getting engaged with people on rethinking around mental and behavioral health. So it's not this treating of a condition, because then as a prerequisite to that, you have to think of yourself as having a condition. There's a lot of stigma, and we have to be aware of that stigma. We're trying to push against the stigma, but we also have to be conscious of what that stigma is. And so, the cliche example would be like, you go into a police department's locker room and you look around and you say, all right, who's depressed? No one's not, the cultures of a lot of organizations that are at highest risk of conditions like this. No one's just saying, oh yeah, I saw a therapist last year because me and the wife were having some fights, and it really helped me think through, how I could be more mindful of myself. That's just not what's happening. And so, yes, we need to work on that stigma, but these kinds of cultural change movements, they can happen overnight, but a lot of times there's a lot of work that leads up to them. Kind of think of it like an earthquake. An earthquake is not one big slip. An earthquake is a number of frictions that have built up to the point that then a large slip happens. So, yes, stigma needs to be reduced. But again, I think we're going to start to see employers figure out how they can invest in their workforce. So we see investment in continuing education, right? Sometimes you'll see employers pay for employees to go back to school, get additional years of training or education. But we've talked about presenteeism, absenteeism, missed work, and stuff like that. I think employers are going to start to recognize the value of investing in their workforce to being as mentally strong and resilient as possible so they can deal with these things. So, you kind of think if you've got a sales force and you've got a bad sales manager and the sales force is burned out, stressed, and they're not producing, that hurts everybody in the organization. If you have an accounting and finance team that's working really late hours and they're not getting things done and they're stressed out, again, there's major issues there. And so there's this really good business case for investing in mental and behavioral health on a first dollar basis, to equipping employees with the skills and the mindsets that they need to address the things that are going on in life, because those obstacles aren't going away. There's always going to be roadblocks and hurdles to clear. The key thing is, how can we equip employees so that they've got the tools and the understanding of themselves to address them up front? And that's where I think we're going to see a lot of development go with mental and behavioral health. There's always going to be more digital therapeutics, but I think there's this really early there's this early intervention that we can do with employees that has major ramifications for organizations, with both their healthcare spending and just with their overall operational excellence.
Absolutely. Mental health impacts everything, truly. Um, Thank you so much. I have so many more questions I would love to ask you, but can't believe we're already out of time. Thank you so much, John, for your expertise and your time, and appreciate it so much.
Yeah, this was awesome. Thank you so much for having me. Thank you for shedding a light on these things. And thanks for bringing together a community of people who is talking about a field that we need more discussion around. We need more emphasis on this. It's awesome where we're at now, that it is kind of this in vogue topic that people are just starting to find, interested in talking about. We need to emphasize on that. We need to build on that and keep building and building and building. And this is a major step towards that. So thank you so much for what you're doing and bringing this community together. Thanks.